Well, I'm Alan Dale from Gale Force Winds, and what an absolute pleasure it is to be here in the beautiful Jag Hotel, downtown St. John's, Newfoundland and Labrador. We are at the big raising money for the Healthcare Foundation, and I love being in conversation with people who are truly making a difference. And on that note, why don't you introduce yourself? Tell us what you do.
I will. So I'm Angela Bussey. I'm the current Clinical Chief of Surgical Services for the Eastern Zone in NLHS. I'm a general surgeon, and I'm here tonight because I want to talk to everybody about the Da Vinci robotic system and how I'm hoping that together we'll be able to bring that robotic system to Newfoundland and Labrador.
Talk to me about it, Doctor. What exactly is this system and why is it so important?
So the system, when we say robotic surgery, people might think it's a robot doing the surgery, but it isn't. What it is, it's robotic assisted, so it allows the surgeons of Newfoundland and Labrador, the people we trust every day with our health, to use technology to further their own skills. So we're going to bring this, hopefully, to Newfoundland and Labrador to impact our patients in gynecology, oncology, urology, and colorectal surgery, so that more complex surgery can be done here in province. People can get amazing care and stay right at home while they get it.
Doctor, put my hands on the equipment. What does it look like? So Newfoundlanders and Labradors can understand what this is?
Yeah, so it's hard to picture because I think, again, you think of a robot as a different entity that comes in. But what it is it's a platform where we attach our own instruments to the arms of the robot. We place them in the patient, right? We do that ourselves. And then we're able to sit at a different console away from it, use our own hands, and it's almost like little pinchers like this in the instrument. And then our movements are translated to those robotic arms inside the patient to basically get where no one's able to get before.
And so why are the robotic arms able to get where nobody's...
Yeah, so think about your own wrist, what it can do, right? So it can only twist so far, and then your hand stops. But with the robot, you move your hand, you can do this. You can hit a button, it locks in place. You reset your hand, and you can go even further. So you get even more than 360 degrees, up, down, over, wherever you need to go. All from sitting comfortably and making sure that you get the job done.
So you got a good range of motion there, better than your hand can provide. But your hand gets fatigued when you're doing things. Talk to me about, because a robot doesn't get tired.
That's right. And so when the robot doesn't get tired, the surgeon doesn't get tired, because after any long, complicated case, your shoulders hurt, your legs hurt, your knees hurt. But with this system, you can sit comfortably for hours on end, right? And it allows you to just take the time you need to do that surgery. You walk away, the patient has done great, the surgeon has done great, and everybody gets a positive outcome.
So as a surgeon, this has to be a game changer for you.
Yeah, it really is. I think this is the first system that we're hopefully able to bring to the province that's actually going to touch so many patients across so many divisions. A lot of times you'll see a certain piece of equipment that's just for a certain procedure, just for a certain division. This goes across all of our surgeries. We are hoping to start, like I said, with gynae, onc, urology, and general surgery, but then we're going to bring that further, hopefully to touch in thoracics, ENT, cardiac surgery. So it's the one piece of equipment and the system that's really going to unite all of the programs, all of the surgeons, and really bring forward that team mentality that we know really benefits everybody.
Will it speed up surgeries?
Yeah, so it definitely can. I think when we're starting, right, everything that's new takes a little bit of time.
Right.
You finesse those skills, but at the end, when you're comfortable, yes, the goal is that this is going to give us, one extra complex surgery a day. That's going to translate to hundreds of cases a year. And what it's also going to do is that the patients will have faster surgery, less invasive procedures, quicker recovery time, back to work sooner, and really there's just no downside.
Doctor, what does it feel like when you come to an event like this and you see so many people sort of leaning into this to solve problems? Well, they're solving problems for the entire healthcare. I mean, healthcare touches everybody, but this is going into the hands of you and your colleagues. What does that make you feel like?
I mean, I will always say we have the best people in Newfoundland and Labrador. We have the absolute best group of donors, and our healthcare foundation is just second to none. And we always prove how we can come together to get a job done. And when we can do it in such an amazing venue as this and get to enjoy everybody's company, it just really says what Newfoundland and Labrador is.
And on that point, a fun event, right? Here we are. putting energy into a very important topic, a very important conversation that touches all of us, but in a nice, fun way. I think that speaks to Newfoundland and Labrador.
Absolutely, it does.
Doctor, it's been an absolute pleasure being in conversation with you, and thank you very much for what you do every single day
Thank you.
for the people of Newfoundland and Labrador. Very much appreciated.
Thank you so much.